നമസ്കാരം. ജോയിൻ ചെയ്ത എല്ലാവർക്കും താങ്ക്സ്. ഇതൊരു ചെറിയ അവയർനെസ്, കൊറോണ COVID-19 കുറിച്ചൊരു അവയർനെസ് ഡിസ്കഷൻ ആണെന്ന് പറയാം, പാനൽ ഡിസ്കഷൻ ആണെന്നും പറയാം, അല്ലെങ്കിൽ ഒരു ടോക്ക് ആണെന്നും പറയാം. ഡോക്ടർ ഖലീൽ അഷ്റഫ് ആണ് നമുക്ക് ഒരു അവയർനെസ് ടോക്ക് തരുന്നത്. സോ അദ്ദേഹം പറയാനുള്ളത്, അദ്ദേഹത്തിന് കുറച്ച് സമയം നമ്മൾ കൊടുക്കുന്നതായിരിക്കും. അതിനുശേഷം നിങ്ങൾക്ക് സംശയങ്ങൾ ഉണ്ടെങ്കിലും അല്ലെങ്കിൽ നിങ്ങൾക്ക് നിങ്ങളുടേതായ ഇൻഫർമേഷൻസ് ഷെയർ ചെയ്യാനും ഒരു പ്ലാറ്റ്ഫോം ഉണ്ടാകും. സോ ആദ്യം ഞങ്ങൾ എല്ലാവരെയും മ്യൂട്ട് ചെയ്യാണ്, ഡോക്ടർ മാത്രമാണ് സംസാരിക്കുക. താങ്ക് യു ഓൾ ആൻഡ് വെൽക്കം. Doctor, you can start.
Thank you. So this is a real കുറച്ച് ബ്രീഫ് ആയിട്ട് വൈറസിനെ പറ്റി ഒന്ന് പറയാം, അസുഖത്തെ പറ്റി. അതിനുശേഷം നമുക്ക് കുറച്ച് നേരം we can all discuss. കാരണം this is ഒരു ഇവോൾവിംഗ് ഒരു സംഭവമാണ്. ഒരു one good thing is എല്ലാവർക്കും ഇതിനെപ്പറ്റി ഓൾറെഡി ഇൻഫർമേഷൻ സോഷ്യൽ മീഡിയയിൽ നിന്നും ഒക്കെ കിട്ടിയിട്ടുണ്ട്. So, but it's good to at least sit together and kore misinformation on social media and ഒരുപാട് ആൾക്കാർക്ക് കിട്ടുന്നുണ്ട്. So, just wanted to make sure we are all on the same page. അതാണ് നമ്മുടെ main goal of the talk today. First of all, ഒരു just nomenclature ഒന്ന് ക്ലിയർ ആക്കാൻ വേണ്ടിയിട്ട്, ഈ ഡിസീസിന്റെ പേരാണ് COVID-19. And the short form actually coronavirus disease of 2019. Actually, it started in 2019. So it's called COVID-19. And the virus in the perana SARS-CoV-2. Okay, that's the actual name of the virus. Is SARS actually stands for severe acute respiratory syndrome, coronavirus 2. That's virus in the pair. So the virus name is SARS-CoV-2 and the disease is COVID-19. Okay. Now, SARS virus comes under the family of coronavirus. ഇതിൽ ആർക്കെങ്കിലും coronavirus വന്നിട്ടുണ്ടോ?
No.
So I can assure you, almost everybody must have had coronavirus. Coronavirus എന്ന് പറയുന്നത് നമ്മുടെ common cold ഇല്ലേ? Common cold വരുന്നതിൽ ഒരു 15-20% of common cold are caused by coronavirus. So coronavirus എന്ന് പറയുന്നത് it's not the specific name. Coronavirus, we have alpha coronavirus, beta coronavirus. We have 7 coronaviruses that affect humans. So HCOV 229, NL63, OC43, these causes common cold. Okay, they cause common cold. So almost everybody would have had a coronavirus infection, because in the technical term of corona, but under the coronavirus, there has been 3 severe types of coronavirus that we have recently found. One is the SARS-CoV, that's the original SARS-CoV, which happened around 2013. And this current one is also in the same category of virus. Both actually uses a cell protein called ACE, or angiotensin converting enzyme 2, and that's a common protein that actually most of you are familiar with. That is actually a drug target for some of the blood pressure medicine, ACE2. So that is a target for both these viruses. And there is another distantly related coronavirus called MERS coronavirus, or Middle Eastern Respiratory Syndrome coronavirus. Okay, so these are the 3 of the 7 coronaviruses. 4 of them no one cares because they cause common cold, but it is just so kind of benign disease, we generally don't even treat them. But I just want to highlight the fact that we have been having common cold forever, and no one really, we always make a joke, have modern medicine ever found a cure for common cold? And the answer is no. Even though the disease is so widespread, no one really cared about making a medicine for common cold because it was common cold. It didn't, it was not like a major public health hazard. What is unfortunate is even after these 2 viruses cause significant number of deaths. In fact, MERS coronavirus and Middle Eastern coronavirus have a higher mortality than the current one. But luckily it was much more well contained. Even after this, it is a failure of the entire medical system, I would say, including pharmaceuticals, that they didn't actually start working on a good antiviral drug. So we, as of now, are scrambling to find a good antiviral. But these viruses have been endemic to humans for centuries or even longer. So this is a quick difference between these three serious coronaviruses. Like I said, 4 of the coronaviruses doesn't cause anything serious, but 3 of them cause serious illness. The SARS from the original SARS actually came from China too, and the reservoir for that was cats, and it was also human-to-human transmission was there. Nosocomial transmission was there. There was a significant risk for healthcare workers. This is a little bit, the corona dates are like, by the time you make the slide, the slide is already outdated. But you can see the countries with reported cases, this is far more than this now, almost 185. The MERS was from the Middle Eastern respiratory syndrome, which actually came from the camels. COVID-19, we think it is come from the bats. Bats are, mammals that harbor a lot of viruses. And ഇപ്പോഴത്തെ virus most likely അവിടെ നിന്നാണ് വന്നതാണ് നമ്മൾ കരുതുന്നത്. This is a common thing you may have seen on WhatsApp and all the social media. This is not very reliable, but in general, what you have to remember is coronavirus almost always have fever, and not always. I mean, in some Chinese studies, 99% had fever, and in some cases, it's less so. But what also is that some patients may have no symptoms whatsoever, totally asymptomatic. But in patients who do have symptoms, these are the things to remember. It doesn't usually cause like the typical acute onset body ache, headache that is usually found in flu. But all the symptoms are very interchangeable. You cannot decide based on the symptoms that whether you have coronavirus or not, because symptoms are exceedingly protean in the sense, ചിലർക്ക് ഒരു symptom ഉണ്ടാവും, ചിലർക്ക് വേറെ symptoms ഉണ്ടാവും. So ഒരു symptom വെച്ച് മാത്രം നമുക്ക് പറയാൻ പറ്റില്ല. There are also cases patient present only with GI symptoms. അവർക്ക് GI symptoms മാത്രമേ ചിലപ്പോൾ ഉണ്ടാവുള്ളൂ. They don't have വേറെ ഒരു പ്രശ്നം ഉണ്ടാവില്ല. In fact, there is a case report, patient ഒരു surgical unitൽ admitted ആയി, abdominal pain ഒക്കെ ആയിട്ട്, and infected a lot of other patients and doctors before they realized the problem was from coronavirus. So when you have a pandemic going on, and if you are not well, it doesn't matter what your symptom is, you need to be careful and cautious in terms of seeking medical attention immediately. The R note എന്നുള്ളത്, again, thankfully to WhatsApp and social media, ഒരുപാട് ആൾക്കാർ have become very familiar with all these terms we use in epidemiology. R0 is the number of patients who can get infected by one person. R naught. The R naught എന്ന് പറയുന്നത് is a common. These are the common or average numbers of different diseases. As you can see, നമ്മുടെ usual influenza is about 1.2 to 1.6. COVID is 2.2 to 2.5. It's actually less than the original SARS, the one that came from the Guangdong province in China. In fact, it is less than the one from the Middle Eastern respiratory virus. Now, what is different with this is, so why would you think, this is affecting more people than the Middle East respiratory virus? Is because Middle East respiratory SARS or the Middle Eastern respiratory syndrome, a lot of patients were extremely ill, so almost 80% were very, very ill. So when a virus causes serious deadly illness, it actually is counterintuitive. It is actually easier to contain. So Ebola, it's terrible illness, very high mortality. പക്ഷേ Ebola വന്നവർ, most of them were extremely ill. The problem with COVID is a lot of patients who get it doesn't even know they have disease. So the COVID in the പ്രശ്നം, they have a high, relatively high R0, and a lot of people have a symptomatic disease. The other thing to remember is R0 is not written in stone. Okay, R0 is not a feature of the virus itself. Of course, virus is part of the problem, but it is the host also plays a major role. Like, R0 depends on how many patients you get. If a patient can infect. പക്ഷേ R0 can be 0 if that person is quarantined and do appropriate protocol, or it could be hundreds of or even thousands of patients, as is unfortunately just recently happened in Kerala. That guy who went around and contacted a lot of people. So R0 is not written in stone. It could vary because of various features. Now this is the data actually as of today morning, that the total number of patients who have confirmed infection is 284,566. This is almost certainly an undercounting, because you look at the number of patients who are actually being tested. America has been extremely unprepared thanks to our very poor leadership. So you see that number of tests in US is far lower than some other countries. South Korea has done a fantastic job. But India is also not very well, in the sense the testing, ഒരുപാട് ആൾക്കാർക്ക് ടെസ്റ്റിംഗ് ചെയ്തിട്ടില്ല. സോ ദിസ് നമ്പർ ഈസ് ഗ്രോസ്ലി അണ്ടർ റിപ്പോർട്ടഡ്. സോ ഒരു സ്ഥലത്ത് കുറച്ച് കേസുകളെ നമ്മൾ കാണുന്നുള്ളൂ എങ്കിൽ അതിന്റെ ഒരു റീസൺ എന്താന്ന് വെച്ചാൽ യു ആർ നോട്ട് ടെസ്റ്റിംഗ് എ ലോട്ട് ഓഫ് പീപ്പിൾ. ആൻഡ് സോ ദിസ് നമ്പർ ഈസ്, ഐ വുഡ് സേ, probably less than half of the actual number. So you certainly can expect at least 500,000 people already have this disease right now. So this is just a comparison. A lot of people compare this to influenza, seasonal flu. Seasonal flu is a different family, by the way. Seasonal flu is not a coronavirus. It's a different orthomyxovirus or other family. But they are similar in that they both affect the respiratory system primarily. Then the R0 is 1.3. Incubation period is 1 to 4 days. This is another feature that helped COVID to spread, because you get the virus, you may not get symptoms until 2 weeks. And in that 2 weeks, you're asymptomatic and you can still spread the virus. Hospitalization rate ആണ് ഇതിൽ വളരെ വ്യത്യാസം വരുന്നത്. So flu ഉള്ള ആൾക്കാർക്ക് 2% ആണെങ്കിൽ ഇത് almost 19-20%. And the fatality rate is almost 7 times or more. So this disease is twice as infectious and almost 7 times as deadly. Okay. Now let's look at the numbers of flu. People just say, oh, don't worry, but it's a flu. But flu is a serious illness. These are the numbers from US last year. CDC website number about 34 to 49, almost 50 million flu illnesses last year. Almost 16 to 23 million medical visits. So that means at least among them, half of them were, sick enough to see a doctor, of which 620,000 people got admitted to the hospital. Okay, that is a huge number of people. And this is what we are talking about flu, by the way, not corona, not the current. I am also using the term corona just for, but it's the SARS-CoV-2 is the real name. So this is the number of patients who got admitted last year. US matram 620,000 people got admitted. Okay, so influenza is a serious illness. Okay, and this disease is twice as infectious and almost 7 times as deadly. So we had near 20 to 52,000 people have died. Average about 40,000 people have died from influenza last year. So you do the math, so multiply that at least by 10. So that is a big number of people we are talking who could potentially die just in US. Unless we control it very rapidly. This is same kind of showing the different mortality at different age. Both the illness, mortality goes up as nammal prayamanthorum mortality koodum. You can see that older ആൾക്കാർക്കാണ് ഏറ്റവും കൂടുതലുള്ള mortality ഏറ്റവും കൂടുതൽ. Average mortality for flu, if you take all age, is about 0.3. Whereas COVID-19 is about 2.3. And this again variable different countries depending on the health situation. And one important thing to remember with mortality is that how many cases are in a small area. So when you have a small area like in the northern Italy, when you have large number of cases in a small area, the hospital system gets overwhelmed and the mortality goes up. So the mortality is not just a factor of the disease, it's also the factor of how many patients are actually getting infected at one time. Now, this is to compare to some other common diseases. You can see COVID comes in somewhere in this. The e-axis, in this X and Y axis, X-axis, we are actually showing the the infectivity, and this is showing the severity. So you can see that some diseases like Middle Eastern respiratory virus actually was much more lethal. Ebola is much more lethal. Bird flu is actually lethal. You know, a lot of people die from it. But very few diseases are not as infectious and lethal, you know. But of course, we had much worse diseases in the past that was more infectious and more lethal. Smallpox being one classic example. Smallpox was extremely contagious and was extremely lethal. You know, in fact, you know, Indians, we know Indians even had a separate goddess just for smallpox. You know, smallpox was such a scourge for mankind for a long time. So I just want to kind of, you know, comparison to different diseases. Now, common cold is somewhere here. You know, it's totally non-lethal, but it is this R0 is about 2. All right. So incubation period in the karyam. So the longer incubation period ulla asugathine, so incubation period koodunathu also help to spread the disease. Karanam ee incubation period ulla samayathu patient ne symptoms undavanilla. So patient in symptoms illengi polum it can still spread the disease. So that's a problem. So this is a fairly long incubation period, 14 days aanu. So the comparison with some other diseases. So this is the symptoms we briefly discussed it. You know, almost everyone has a fever. Most people have a dry cough. Dry cough no sputum undavilla, പക്ഷേ have sputum. Fatigue is common. Shortness of breath. This is all the patients. You know, in of course serious cases, this is much more. This is the kind of common symptoms to think of. And like I said earlier, symptoms are very protein. Ellarkum symptoms undavanannilla. Adu matramalla symptoms can be very different. So this is nammude medical case definition. You have to have a acute respiratory illness with concomitant probable exposure. But now we have expanded it to include anybody who has an acute illness, especially respiratory illness, where and you can't exclude other causes. Okay, this is one of the clinical guidelines that's been widely distributed among medical professionals. This is what we do when we have a patient. So there are certain labs that you can do. The common blood work, CBC in common blood group, common complete blood count. So the complete blood count is a very simple test, and usually what it does when you have a pneumonia and all, you can increase white count on usually Ghana. But most viral illness, including this, you see a reduced white count. And other than lymphopenia or lymphocytes subsets are ഏറ്റവും കുറഞ്ഞ Ghana. In fact, severe lymphopenia, that's a lymphocytes വളരെ കുറവാണെങ്കിൽ അവരുടെ mortality is actually significantly higher. പിന്നെ D-dimer എന്ന് പറഞ്ഞ non-specific marker, very high D-dimer is also associated with high mortality. So this is just, I think this may not be applicable. This is just how we kind of in medical setting, how we deal with this disease. So one issue to remember is testing is not very accurate. Okay, testing, one thing, it is not widely available, and that's unfortunate. And even if you have a negative test, nammaladu clinically valare suspicion undengil, you have to repeat it. Karanam almost 23% alkaril you get a false negative. So you go and test for the COVID and the test come back negative. That doesn't necessarily mean you don't have the disease. So if you have the symptom, if you have the exposure, you could still have the disease. You may have to retest. US CT has been limited because scans it's very difficult, in the sense the whole scanning room and all has to be re-cleaned. But Chinese have done a good number of CT scans. Our data, they have good findings on the CT scan, but it's non-specific. It is very sensitive. A lot of people with the disease will have some abnormality on the chest X-ray and more commonly on the CT scan. But that is not required for diagnosis. That is also very complicated because you have to sterilize the whole room, and you know, it's a very cumbersome procedure. So once you have a patient in the hospital, again, these are mostly for medical professionals, if there are any. You know, we have to use the adequate precautions because this medical facility, the spreading is very common. In fact, doctors and nurses are not only helpful, they can also be carriers. You know, that's important to remember. Unfortunately, a good number of cases, especially in some Nordic countries, they found there were a cluster of cases which actually came from some of the healthcare workers who were carriers. Healthcare workers are also at risk for infection. Italy, there is almost 8 to 9% of all the patients who are affected are healthcare workers, which is unfortunate. And the mortality or the seriousness of the healthcare workers appears to be a little bit more. And it could be because they have a higher exposure, higher level exposure, including, as you all know, that Chinese doctor who first reported the case, the ophthalmologist, unfortunately died from the disease. The Italian chief of critical care in the northern region, he died from the disease, which was all unfortunate. So this is the clinical picture. 80% of people will have non-severe disease. And when you see this picture, one of the things as human nature happens is that everyone thinks we will be in this 80%, but there is no saying. Even if you're young and healthy, you could still be critically ill. So don't look at this thing, okay, I'll be in the 80%. No, there is no guarantee that that can happen. About 20% or 15%, 20% of them will have serious illness. Of the 20%, 15% are severe illness, but not requiring ICU, but 5% require ICU, including intubation. Okay, so the mortality of these patients is almost half of them. So about 40 to 60%, 40 to 62% of patients who are in the ICU could die. And if you look at the critically ill patients, the 20%, their mortality is about 8%. And if you only take the non-severe, they have a 0.1% mortality. The total aggregate mortality is between 2 and 3%. So 20% of patients who are critically ill have a mortality of 8%. And the ICU patients have a mortality, about 50% of them could die. And the common cause of death is respiratory failure is the commonest cause. The lungs are the common affected because the ACE protein is very much expressed on the alveoli, lung into cells on alveoli. So alveoli has a very high levels of ACE. So lungs get one of the brunt of the disease. Respiratory failure followed by heart also, vascular system, as all of you know, ACE inhibitor, these are medicine that you use for blood pressure. So, so you can actually have cardiac and vascular damage. In fact, some of the cases of patients who died, patients recover from the lung problem, and then they can suddenly collapse and die because of heart failure or cardiomyopathy. Okay. And the highest risk is in patients who are older. This is the data from Italy and China. You can see in both Italy and China, the older folks had a higher mortality. One of the things you commonly see is the Korean mortality is lower. The average age of a Korean patient is 40. Average age of an Italian patient is about 78. So part of the reason the mortality is different in different countries is the average age is different. It is not just a matter of healthcare and the quality of healthcare on all those things. So you can see the old folks above 70 goes up to 10%, and above 80, 17 to 15%. And these are countries, by the way, both Italy and China have exemplary medical facilities. This is with the best healthcare we could provide. So these numbers are pretty high. Also, when you have other diseases, your risk goes up. When you have heart disease, diabetes, respiratory illness, or cancer, their risk goes up. But even if you don't have any illness, you still have a risk, about 1%. Okay, this is another data showing the same thing. So of all the people who died, 1% of people died with COVID had no other illness, none whatsoever. But most patients have at least one condition, like say hypertension or diabetes. 26% had 2 conditions, and 48% has 3+ conditions. Okay, so other illnesses increase your mortality. Now, this is the trajectory of the illness, which again you must have seen in several groups. You can see that initial pace is very rapid. In Italy and Iran, this has still not stabilized. China has done a really amazing job. Actually, they did stabilize this graph. US is unfortunately going the same graph as Italy. So this is some other countries that have done a better job. Singapore and Japan, their slope is definitely better. South Korea has also, after initially taking lightly, they have actually been able to slow the spread. Italy, as you can see, has slowed the spread. I just want to show this next picture. This is to show the R0 and the spread of infection and mathematical progression is not the whole story. Okay, this is a data from China, actually from a couple of months ago. If in China, if it was progressing with a R0 of 2 and was spreading the way it was spreading the first few days, this would have been the number of patients who would have had the disease. Do you all see the numbers? This blue, the number in blue are not real numbers. Okay, these were mathematical projections. So you can see, way before, like about 2 weeks ago, China would have had like over, so it's a humongous number of patients, almost 1 million severe cases, and huge number of patients who should have died in China. This is if it was done without any control. But you can see that China, hardly any cases now. They probably have no more cases. The only few cases they have are imported cases. So this is not a lost battle. China has already shown it can be won. So this is another thing that you all have seen, basically flattening the curve. Basically, the idea is, unfortunately, this virus is going to affect a lot of people. Our goal is to not to have everybody getting sick at the same time. I'm going to show you some numbers of US and Canada. There is only limited number of ICU beds, limited number of doctors, limited number of ventilators. So you want the disease to be spread out over a longer period of time. So same number of patients, if they get the disease over a 4-month period versus same number getting within a 1-month period, they're so totally different. Mortality is going to be different. So you can see that a 1-day social distancing, just 1 day, could significantly reduce the spread of disease. You can see this is the cumulative cases. Even with 1 day, you started 1 day early. That basically you start the social distancing 1 day early. It's going to be better. Start the epidemic and you start at day 20 versus day 21, day 22. So every day you're losing, you are going to increase the cases. Now, this is another thing, very useful to see how much, very rarely ordinary people can save lives, but anybody can save lives in a pandemic. So this is the number. You can see here, one school close to the you can save about 10 patients. 100,000 people conference cancel, you can save 200 lives. And if you and 20 co-workers stay home for 4 days, you can save 1 life. So if you are staying at home, working at home, you are actually saving lives now. Okay, that's a good thing to remember. So, so staying home and sick prevent you from transmitting 2 to 3 other people and causing 100 others to get it. Of whom 10 to 20 are likely to be hospitalized and 1 is likely to die. So this is the story of the bad example that some of the people in Kerala that we also on the social media. He has potentially is, you could say, is kind of being murderous. When you have a disease or symptom, walking around, it's potentially, it should be a criminal offense. Now, this is what I was going to say. Every country has only limited number of ventilators. In fact, the number of ventilators ഏറ്റവും കൂടുതലുള്ള രാജ്യം actually US ആണ്. US has about 35 ventilators per 100,000 inhabitants. Okay, because you don't need too many ventilators, in a normal situation. Canada, this is the best example, the best that I could see. Canada has about 19 ventilators in Newfoundland. But some other provinces, British Columbia, Alberta has about 7 or 8. So it apparently varies in Canada, but so in general, this is the number of ventilators. In India, we have about 2.3 ventilators per 100,000. Okay, so that's just to give an idea. And this is the total number of ICU beds in US. So we only have 100,000 ICU beds, and the average occupancy rate in the US about 70% ആണ് ventilator occupancy. എന്ന് വെച്ചാൽ ഈ 100,000 ventilators വെറുതെ കിടക്കുകയല്ല അവിടെ. They are having already patients. US Army, US military, and other forces may have another 50,000 or more. So we may have at most about 70,000, 80,000 extra capacity for ventilators at the same time. അപ്പം ഒരുപാട് ആൾക്കാർക്ക് ഒന്നിച്ച് അസുഖം വന്നാൽ there is, you are going to, will have to do what the Italians will have to do, which is terrible. As a physician, you will have to decide whom to intubate, whom not to intubate, which is very unfortunate. Now, quickly about some of the common things that you all have seen this. So, common hand washing, because this, and you have to wash with soap, is not just water. You need soap for the virus to go away. Don't, when you sneeze, it may be just common cold, but use common sense. Throw away, use tissues, use your sleeve. These are all things you must have all seen many times. Again, social distancing is the key. This spread primarily through droplets, so it can spread up to 6 feet or 2 meters. So if you are with a person who you are a friend or anyone, stay 6 feet away. Okay, that is the most important lesson from today. 6 feet aglam nikka. The other important thing people don't remember is that touching surfaces. There was a picture of China, and I thought that was very funny. Or funny in an unfortunate way. They were like, all these women wearing വലിയ mask ഒക്കെ കെട്ടിയിട്ട് they were holding on to the railway ഈ സാധനം പിടിച്ച് നിൽക്കുന്നത്. So most of the time you get infection not from from another person, you get it from touching a surface and then touching your face. So we all touch our face without being aware of it constantly, and the virus can last up to, in some studies, up to 9 days in certain surfaces. About one, ideally don't touch. If you want to touch something, use a pen or carry some tissue with you. Elevator buttons and all are major sources. Trolleys in places like shopping centers, അവിടെ നമുക്ക് ടച്ച് ചെയ്തിട്ടാണ് നമുക്ക് വരുന്നത്. So in terms of very 3 more slides about potential antivirals that may have some use. This one, the remdesivir is a very short supply, but Gilead actually has a compassionate use program in severe patients. This probably is the most active of the antiviral drug that we have right now. There is also some other combination drugs. This is also used in HIV. So there are some of the drugs that we are using that may have some activity. This is HIV treatments called lopinavir, ritonavir, has some activity. This is the initial study that showed this drug, which is an antiviral, that actually has some activity. Hydroxychloroquine and chloroquine is very commonly available anti-malarial drugs, appears to have some activity. In fact, this study, which was very small in number, this is not a large trial, but these are desperate times, so sometimes we may have to kind of take data as it comes. So this is a data that showed patients who had a combination of hydroxychloroquine, which is Plaquenil, which is a drug that is used in treatment of rheumatoid arthritis, along with Zithromax or azithromycin. These are 2 very old, very cheap drugs, widely available. It appears to reduce a viral load. In fact, in Alabama, as a group of physicians, we are actually considering starting this on every suspected patient as soon as they come, based on this data. So this, what it shows is that decrease the severity of the disease and decrease the viral shedding. Again, these are all not hard science. In science, modern medicine, unlike alternative medicine, we need very strong phase 3 data. But when it is at desperate times like this, we have to go by whatever available data we have. So of course, you all see this picture of this brave lady who got the first the vaccine. Hopefully we should have a vaccine in a couple of months, which hopefully is effective and safe, but that's several months away. Vaccine takes time to develop, and so we are far from a virus. Now I'm going to end the talk by this slide. This is just to show that this is a serious illness, but in the big picture, there are certain other diseases that is still killing more people even now, even today. But you can see that within a short few months, this has gone up in the number of deaths, and we are nowhere near the peak of this disease. Including US, India, many large countries, it has not peaked yet. So just to kind of give a kind of an idea about compared to where does it fits into other infections. And in terms of pandemics, again, some people say this is end of humanity. Humanity has suffered a lot more. In fact, if you look at the number of people who died from various illness, this is a very nice infographic. Some of you, you can see that bubonic plague, there are 200 million people at least may have died. So the plague term is actually not for a disease. Plague actually, comes from the word Italian plagiara, or lamentation. So then it became a particular disease. But these are all plagues that has affected humanity throughout our history. So there was an interesting interview I was hearing early, actually today morning, when an epidemiologist, you talk to epidemiologists about a pandemic, they talk about that is one of the natural things that always happen. Ipo nammal oru flooding or oru earthquake we never talk like, oh my God, if I hope it will never happen again. We say that, but we know for a fact it is going to happen. Earthquake, flooding, pandemic is unfortunately part of human history, and we are going to have, unfortunately, more pandemics along the way. The only thing we can do is how to shorten the duration and save ourselves and save others, and use social distance, flatten the curve. And I think that's the end of the talk, and I'm sure you'll have some comments, questions. I know you will have other experiences, other information. And this is an evolving disease, so there are so many things I have not covered, but I just want to kind of give a brief overview. Thank you all.
Thank you so much, Doctor. It was a very informative information for me, at least. Misconceptions ഉണ്ടായിരുന്നു. ഏതൊക്കെ മെഡിസിൻസ് ഉപയോഗിക്കാം, ഈ പറഞ്ഞതുപോലെ ബ്ലോഗ്സ് എഴുതുന്ന ആൾക്കാർ ഒത്തിരി എഴുതുന്നുണ്ട്. സോ ഒരു ആ ഫീൽഡിൽ വർക്ക് ചെയ്യുന്ന ഒരാളിൽ നിന്ന് കേൾക്കാൻ നമുക്കൊരു വിശ്വാസം കുറച്ചുകൂടെ തോന്നും. സോ താങ്ക് യു സോ മച്ച് ഫോർ യുവർ ടൈം. പാനൽ ഓപ്പൺ ആണ്, ചോദ്യങ്ങൾ ഇപ്പോൾ നിങ്ങൾക്ക് ചോദിക്കാം ഡോക്ടറിനോട്. ഐ ബിലീവ് യു ഹാവ് സം മോർ ടൈം. സോ ആരാണോ ചോദിക്കുന്നത് അവരൊന്ന് അൺമ്യൂട്ട് ചെയ്തിട്ട് ചോദിക്കാം.
എനിക്കൊരു കാര്യം ചോദിക്കാനുണ്ട് ഡോക്ടറോട്. ഡോക്ടർ, ഇപ്പൊ നമ്മളിപ്പോ അപ്പാർട്ട്മെന്റിലാണ് ഇവിടെ താമസിക്കുന്നത്. അപ്പൊ നമുക്ക് ഇവിടെ ലോണ്ടറി എന്ന് പറഞ്ഞ കോമൺ ഏരിയയിലാണ് നമുക്ക് ഇത് ചെയ്യുന്നത്. അപ്പൊ നമ്മളിപ്പോ ഡ്രസ്സൊക്കെ ഞങ്ങളിപ്പോ 1 വീക്ക് ആയിട്ട് അവിടെ ഒന്ന് കൊണ്ടുപോയി വാഷ് ചെയ്തിട്ടില്ല. അപ്പൊ അങ്ങനെ വാഷ് ചെയ്യുന്നതുകൊണ്ട് എന്തെങ്കിലും ബുദ്ധിമുട്ടുണ്ടാവും? മീൻസ് ഇപ്പൊ നമ്മളൊരു കോമൺ ഏരിയ, നമുക്ക് അറിയത്തില്ല അവിടെ ഇതായിട്ടുള്ള ആൾക്കാർ വന്നിട്ടുണ്ടോ ഇല്ലോ എന്ന് അറിയത്തില്ല. പക്ഷെ അതല്ലെങ്കിൽ നമ്മൾ വീട്ടിൽ തന്നെ ബാത്റൂമിലിട്ട് തന്നെ വാഷ് ചെയ്ത് എങ്ങനെ ഇതായിരിക്കും അതിലൊരു ബെറ്റർ? ഇതുകൊണ്ട് വല്ല എന്തൊരു ഉപദ്രവം ഡ്രസ്സിൽ ഇതിൽ ഈ വൈറസ് ഇത് ചെയ്യുമോ എന്നുള്ളതാണ് അറിയാനുള്ളത്.
So virus is very thermolabile. എന്ന് വെച്ചാൽ ചൂടില് അത് പോവും. അപ്പം ചൂട് വാഷിംഗ് മെഷീൻ ചൂടിലിടുക, അതിന് പുറമെ ഹീറ്റർ ഡ്രയറിലാണല്ലോ അത് ഇടുന്നത്. ഡ്രയറിൽ മോസ്റ്റ് ഓഫ് ദ വൈറസ് ഡോണ്ട് ലാസ്റ്റ് ആഫ്റ്റർ ദ ഡ്രയർ.
ഓക്കേ, അത് കുഴപ്പമില്ല. അതുകൊണ്ട്
so put it in high dry and high temperature.
One more question. ഇതിപ്പോ എയർബോൺ ആണെന്ന് കൂടെ ഒരു ഇത് റൂമർ കേൾക്കുന്നുണ്ട്, അത് സത്യമാണോ? അത്
that's a good question. It is mainly droplet, so 6 feet is the usual distance. But experimentally situation, it can be spread through aerosol. It can last up to 3 hours in aerosol media. And those were all high intensity. Hospitals ഈ ബ്രോങ്കോസ്കോപ്പി ഒക്കെ ചെയ്യുന്ന സ്ഥലത്താണ് അത് കണ്ടത്. സോ if നമ്മളിപ്പം ഒരു ICU ഒരു ബ്രോങ്കോസ്കോപ്പി എന്നൊക്കെ പറഞ്ഞിട്ടുള്ള ഇതൊക്കെ ചെയ്യുമ്പോൾ, പ്രൊസീജിയർ ഒക്കെ ചെയ്യുമ്പോൾ, you can create a lot of aerosols. Aerosol എന്ന് വെച്ചാൽ അല്ലെങ്കിൽ നെബുലൈസർ കൊടുക്കുമ്പോൾ അപ്പം എയറോസോൾ ഇങ്ങനെ എയറിൽ വന്നിട്ട് it can last up to 3 hours. പക്ഷെ കമ്മ്യൂണിറ്റിയിൽ അത് it is not well established yet. കമ്മ്യൂണിറ്റിയിൽ എയറോസോളിൽ കൂടെ സ്പ്രെഡ് ചെയ്യാന്ന് പറഞ്ഞാൽ it is extremely complicated. പക്ഷെ that is mostly in the hospital. അത് കാരണം ഹോസ്പിറ്റലിൽ we all have to wear so-called special personal protection equipment and all to go into this patient's room.
And one more, ഞങ്ങളിപ്പോ ഒരു നെക്സ്റ്റ് മന്ത് കൂടി പ്ലാൻ ചെയ്തിട്ട് നെക്സ്റ്റ് സ്റ്റേറ്റിലോട്ട് മൂവ് ചെയ്യാൻ വേണ്ടി പ്ലാൻ ചെയ്യുന്നുണ്ട്. നെക്സ്റ്റ് സ്റ്റേറ്റിലോട്ട്, വിർജീനിയയിലോട്ട്. സോ അപ്പൊ ഈ ഒരു സിറ്റുവേഷനിൽ ഇപ്പം ഒരു എത്ര നാളെടുക്കും ഒരു ട്രാവൽ ചെയ്യുന്നതിന് ഒരു ഏകദേശം ഒരു എത്ര നാളെടുക്കൊണ്ടായിരിക്കും ഇത് നമുക്ക് ചെയ്യാൻ പറ്റും? കാരണം ഇപ്പൊ അവിടെ പോയാൽ നമുക്ക് കുറച്ച് നാളത്തേക്ക് ഒരു ഹോട്ടലിലൊക്കെ സ്റ്റേ ചെയ്യേണ്ടി വരും, അവിടെ അപ്പാർട്ട്മെന്റ് റെഡി ആകുന്ന പറയാം. അത് നമുക്ക് സേഫ് ആണോ അല്ലെങ്കിൽ അത് അവോയ്ഡ് ചെയ്യുന്നതാണോ, എങ്ങനെയാണ് അതിനെ കുറിച്ചുള്ള ഒരു അവരിപ്പോ തൽക്കാലം അവർ വർക്കിംഗ് ഫ്രോം ആണ് ചെയ്തിരിക്കുന്നത്. പക്ഷെ ഇങ്ങനെ ഒരു 2 weeks 3 weeks ചിലപ്പോൾ പോകേണ്ടി വന്നു കഴിഞ്ഞാൽ അതൊരു ഇതാവോ എന്നുള്ളതാണ് ചോദിക്കുന്നത്.
Right. So again, like I said, it's hard to predict, but travel is best avoided, at least for the time being, because now flatten the curve. Unfortunately, a lot of people are going to get this disease. The only thing is to make sure not everyone get at the same time.
Okay, thank you.
Hello, doctor. Kekanda?
Yeah, yes, only.
Yes. Doctor, recently ഞാനൊരു ടോക്ക് കേട്ടത് സാം ഹാരിസും ഒരു ഡോക്ടർ അഡീജ തമ്മിലുണ്ടായിരുന്ന ഡിസ്കഷൻ ആയിരുന്നു. So what Dr. Adija said was that the actual mortality rate might actually be much lower because the denominator is not determined, right? So he was saying that the upper limit might be as low as 0.6%. അതിനെ പറ്റി എന്താ ഡോക്ടറുടെ അഭിപ്രായം?
So so that's a good point, but at the end of the day it really doesn't matter, because either the mortality is low or the case is high, but at the end of the day people are dying and people are getting sick. That is very true. The current estimated mortality of 2 to 3% may be an overestimation, and that very well could be true, but as it happens the absolute number of people who are dying is the same, right? Whether your mortality is 0.6% or 2.3%, 12,000 people already have died, and so that number is that I totally agree with you.
Okay, one more question. ഒരു വളരെ കോമൺ ആയിട്ടുള്ള ഒരു റൂമർ എന്താ വെച്ചാൽ countries that have a warmer temperature, ആ ഒരു റൂമർ രണ്ടും കേൾക്കാനുണ്ട് അല്ലേ? So what are your thoughts on that?
Very, very good question. So it's actually summer, good summer in Australia, and Singapore also is pretty warm. Most of these coronaviruses, including common cold, as you know, it is called common cold. It's more common in colder climates. They do, human, part of the reason is our body is more than the virus. Our body is actually more susceptible for viruses in colder weather. However, that doesn't really exclude, transmission and disease happening in warmer climates. However, everyone is hoping it might be lower in a warmer climate, but again, it is not fully proven, because many places, say 185 countries, that is every kind of temperature, zones affected, and so that shows that this virus is pretty sturdy, and it can affect every climate.
Hi, Doctor. This is Shibu. I have a question. So when we go to groceries to buy groceries, and we have to go to the cashier. So at that time, how can we prevent it? Does wearing a mask will prevent it, or do we need to do anything else?
I would basically use social distancing, try to as much as possible. But like I said, there are certain things, we can't avoid. A mask, generally the common mask you see, generally don't prevent it, but it might at least help you, prevent you from touching your face constantly. Now, the real mask, that medical people use is so-called the N95 mask, which is kind of hard to wear for most people. It needs some training to use it. And if you actually wear an N95 and you have no trouble breathing, that means you are not wearing it properly, because it does actually kind of make it hard to wear. The regular mask, the regular mask is, you should absolutely wear it if you have cough. It definitely helps. If someone has cough and sneezing, it helps from that person from spreading. But whether it is going to help from someone else is not very true. And as soon as you come back from the grocery store, make sure you have hand sanitizer and wash your hands, and try to be very cognizant not to touch your hand to your face after something like that.
After that. Okay. Because we cannot keep that 6 feet distance when we are at the cashier.
I agree. 3 feet is, at least 3 feet you should be, it's
sure. Okay, thank you, doctor.
And self-checkout.
Oh yeah, that's another option. Okay, thanks.
Doctor, how much is this hand sanitizer helps?
Hand sanitizer is a kind of a shortcut if you can't wash your hands. It's definitely not as good as washing hands with soap and water. So, it's easier in the sense you can do hand sanitizer more frequently. Kai washing you have to get to a source of water. But it's not not as good as washing your hands. Definitely, if you have the option washing your hands versus hand sanitizer, always go for washing your hands with soap and water.
Okay. By the way, I just wanted to appreciate that the slide that you showed about the social distancing and how much life it can save, right? I was debating in my mind why India have pursued a Janata curfew and all, but that slide answers that question.
Yeah.
Thank you.
It has to be done on a persistent basis though, on a daily basis.
Rajesh.
Go ahead, Rajesh.
As usual, excellent talk.
Thanks, Rajesh.
So one question I have is, you put up the statistics of the number of people dying in the US or in the world. I think, about 50,000 per year due to flu, right?
Yes. By the way, that is just US, okay?
That is staggering. If you think of that in perspective, that's like, 100 and something plane crashes or something, right? So why are we not like, it's just shocking. I heard this number somewhere before, but I didn't believe it,
Yeah.
So can you expand on that?
This is what we get for the kind of leaders we have. So unfortunately, we spend like more money than the next 7 or 8 countries combined on military, but that is way overspending, and and while at the same time cutting funding for research and NIH and CDC. So you're absolutely right. A lot of people find the number of people who die from regular flu staggering. In fact, let me tell you a number. There's a fact that a lot of you may not know. Getting a flu shot actually for a society increase your average life expectancy of that society more than if everyone exercises. Wow. Okay, this is mind-boggling, right? Exercise is fascinating. It is really healthy. Make you live longer. But for a society of like say 1 million people, if everyone get flu shot, actually their average life expectancy goes up more than if all 1 million of them exercises. So so flu is a serious illness. Even with the flu shot, you may still get the disease, and that's why we, unfortunately, even pharmaceuticals don't spend a lot of energy and money on these diseases. And infectious disease have been, even for antibiotics, it's been years since we had a new antibiotic. People are more focused on chronic illness because that's where the money is. But these acute illnesses and viruses and bacteria, and like I was telling, common cold, of course, we could forgive the pharmaceutical industry for not making an invention to cure common cold. But common cold is no longer common cold. Among the 7 common cold viruses, 3 of them are life-threatening. And 1 of them is now causing a global pandemic. And we had time since 2012 or 13 when we had the first SARS, but nothing happened. I totally agree with you. This is as mind-boggling to you, to me as much as to you. Why we don't do anything for something that killed 50,000 people in US alone. That's just US, by the way, where we have, I think, at least some data. How many patients who die from this world over is probably mind-boggling.
Thank you. Yeah.
Actually, I asked a question in the group, but nobody bite on that one. That bait was not attractive enough, I guess. What will be the future of this one once we have done the social distancing and somehow we curb this epidemic? Will the medical society will come up with a vaccination, and that vaccine, how much that vaccination will be effective, since the virus can mutate and come and attack a different way?
I know these are great questions for which no one really knows the right answer. Only thing that we know for sure is that in the last almost 4.5-5 months, the virus have really not mutated hugely. It has 2 strains, L and S, but they are not totally grossly different. And there is a strain in Singapore that has actually lost certain amino acids and is slightly less virulent. That's the only major substrain that we know of. So the fact that this is not mutating as much as a flu virus, one of the problems with flu vaccine is you are always making a flu vaccine for this year's flu vaccine is based on last year's strain. So that's why flu vaccine is never 100% effective. This hopefully will not have that much of antigenic drift and shifts. We call it antigenic drift and shift, which is why each time the influenza is one of the most adept at antigenic shift and drifts. That's why flu vaccine is not very effective. This hopefully will be more effective. In terms of what's going to happen to this virus, it may become endemic, unfortunately, and it may become a seasonal thing. Our only hope is that in general, each year, the people who, the virus may get less virulent. As far as the virus is concerned, this is the kind of beauty of evolution. As far as the virus is concerned, its goal is not to kill you, because, killing a person makes the virus less effective. And that's why Ebola is less of a problem. For the virus to be the most successful viruses are the ones that make people sick, make them sneeze and cough, but, and then let them spread and, don't kill. So the best we can hope is that the virus will be, less virulent, and we really hope that we have a good, effective and safe vaccine by next year. And because the drug companies and all are getting on board, and there's a huge amount of research going into this, hopefully we should have better medications also by next year. But I hate to say this, but I don't think this is a one and done thing. We may have some form of this for a while, at least less virulent form as an endemic disease.
Doctor, there was also recent reports that in the US, they're seeing increased rates of hospitalization among lower age groups than not just aged people, but lower people as well, lower age groups as well, right? That is very concerning, right?
Yes, absolutely. So yeah, being young doesn't protect you, and that's very important, because you can see those pictures of young kids going to the beach and, saying, yeah, it's not going to bother us. No, it's not true. Actually, age is not the sole factor. Yeah, of course, every disease, if you're younger, you're better. But young alkarkum asugam vannu kazhinjal, some of them are getting very sick.
Doctor, we porthu poi kazhinja clothes okke immediately wash cheyano. Nammade t-shirt, jeans, anganeke.
Yeah, if you had contact, if you had contact with someone, yeah, I would. If you think, you're a healthcare professional, yeah, I would. I just actually, yeah, that's what I do. I mean, yeah, if you're a healthcare professional, if you're in a high risk environment, yeah, you want to be careful about those things.
Okay.
Yeah.
And one more question, Doctor. Nammal ipo letter okke receive cheyyana endengilum problem, like, endengilum problem undago?
Well, yeah, it is supposed to last about 2 days on cardboard. So yeah, I mean, if you have packages and all, yeah, use caution, I would say, use a disposable gloves or wash your hands after that. Doesn't hurt.
Okay. Yeah. So, we letter ko 2 ദിവസം കഴിഞ്ഞിട്ട് mailbox എടുക്കുന്നതായിരിക്കും better.
Yeah. I mean, yeah, unless you are waiting for some important mail. Yeah, that may be a little bit extreme, but yeah, just wash your hands after you open it. Yeah.
Open it, yeah, okay. That's fine.
ദിവസം mail വരും ലക്ഷ്മി.
അല്ല അതല്ല ഞാൻ ചോദിച്ചത്. ഇപ്പൊ മെയിൽ ഇപ്പൊ ഞങ്ങളിപ്പം കുറച്ച് നടന്നിട്ട് വേണം നമുക്ക് പോയി എടുക്കാൻ. അപ്പൊ ഈ ഒരു അവസ്ഥയിൽ നമ്മൾ അത്ര റിസ്ക് എടുക്കണം, കാരണം അവർക്ക് ആർക്കെങ്കിലും ഇത് ഉണ്ടോ ഇല്ലെന്ന് നമുക്ക് അറിയത്തില്ല, മനസ്സിലായില്ല. മെയിൽസ് ആണെങ്കിൽ അല്ലെന്നുണ്ടെങ്കിൽ കാരണം അല്ലാതെ തന്നെ കുറെ ഈ ആഡ്സിന്റെയും കുറെ ഷോപ്സിന്റെ ഒക്കെ ഇത് വരും. അപ്പൊ നമുക്കത് മെയിലിലും വരും, ഇവിടെ നമ്മുടെ ഇതിൽ വരുന്നതിന് മുമ്പ്. നമ്മൾ ഇമ്പോർട്ടൻസ് അപ്പൊ അതുകൊണ്ട് നമ്മൾ പോയിട്ട് എടുക്കണം എന്നുള്ളതാണ് ഞാൻ ചോദിച്ചത്.
ഡോക്ടറെ, ഒരു കാര്യം ഇപ്പൊ ഡോക്ടർ ആ ചൈനയുടെ ഗ്രാഫ് കാണിച്ചല്ലോ. You showed how if China had not controlled the bad situation they could have been in, like ഇപ്പൊ യുഎസിലെ what is your opinion? ഇപ്പൊ കേട്ടോടത്തോളം അവിടുത്തെ ലീഡർഷിപ്പ് ഇപ്പോഴും വേണ്ട മാതിരിയുള്ള ഇത് ഡയറക്ഷനിൽ എടുക്കില്ല അല്ലെ? അപ്പൊ അത് കണ്ടപ്പോ എനിക്ക് ശരിക്കും പേടിയായി. ഞാൻ കാനഡയിലാണ്, എന്നാലും യുഎസ് ആ ഒരു നിലയിലേക്ക് വരാൻ സാധ്യത ഉണ്ടെന്ന് തോന്നുന്നുണ്ടോ ഡോക്ടറിന്?
Unfortunately, no. It's of course partly from leadership, partly because US is not China. അതുമാരത്തെ control നമുക്കിവിടെ, we can't afford, ഒരു ഡെമോക്രസിയിൽ അങ്ങനെ പറ്റില്ലല്ലോ. So that's why personal responsibility is more important in places like China, I mean in US and Canada and India too. കാരണം Chinese actually have much more data driven, they know everyone's business way before all this. They have extreme granular information of every every person's whereabouts. They had this app that everyone has to download, and that will track them, and it will show you in the app in what category you are. Those are things that only China could do, because they had the data even before all this started. Yeah, in places like US, it could be worse, I'm afraid. But people are taking it now seriously, including people who were trying to say this is nothing to worry. I think serious. So hopefully we should be able to slow it down. Hope. But so far the trend has been very unfortunately paralleling that of Italy, which is kind of scary.
അതുകൂടി എന്താ ഇറ്റലിയിൽ ഇത്ര പ്രശ്നം? അവർ കുറെ ആഴ്ചയായി അവർ കംപ്ലീറ്റ് രീതി. Actually, I was supposed to be in Rome this week, but anyway.
Not a good place to be.
Yeah. Why is it that even now has it started getting better? എന്താ അവിടെ ഇത്ര മോശമാവാൻ കാരണം?
Run on hospitals. So part of the reason is the age group is different. They have we always talk about Italians. They have one of the higher average life expectancy. Nalla karyana, but they also had that actually kind of came back and bite them. Pinne avade ee corona areas ilana idu vannathu. Appo aa corona areas il vannappo they had that's a actual flattening the curve, so they didn't do it on time. So Italy is a good lesson for every other country, because they took it lightly. There was a message on one of the doctor's site from a doctor in ER in New York. So the thing is, in the beginning, there is nobody, no case, everyone think we are overreacting, and then all of a sudden we get overwhelmed. That's what happened. That's happening right now in New York, and this was from an ER doctor I know who wrote from New York. So everyone, including physicians, everyone are saying, oh my, this is all like we are being too hyper, we are being overactive, we are just canceling all the surgeries for no reason. And then all of a sudden, there's a power of exponential, right? So you don't see once in a while, like then you see one case, then you maybe another 2 cases, then in 1 week your ER is full of cases. You have suspected COVID.
Doctor, ഒരു ക്വസ്റ്റ്യൻ, ലൈക്ക് നമുക്ക് പറയാതെ കോമൺ കോൾഡ് പോലുള്ള സിംറ്റംസ് ഉണ്ടെങ്കിൽ ഇതിന്റെ ടെസ്റ്റ് ചെയ്യണോ? കൊറോണ ആണെന്ന് ടെസ്റ്റ് ചെയ്യാൻ പോകുന്നതാണോ നല്ലത്?
So the thing is, if your testing is easy to do, I mean, it doesn't hurt, because the more people get tested, at least it will make you at peace. And if you accidentally have COVID, you can make sure that you don't give it to someone else. But the problem is, if the testing is complicated, and if you are going to expose yourself to a higher risk going to get tested, that's not a good idea, right? Suppose you have to go to a doctor's office to get tested, and that is going to make everyone's life more miserable, because the doctor's office will be filled with more people who should not be there. But if you are like, say, in Korea, I mean, I don't think, at least for now in US and Canada, we don't have that rapid turnover. Korea, they have this walkthrough. The patients are already instructed 1 kilometer behind. They put the car, the AC on circulate mode. In case you all have to do that, to go to a testing center, make sure the car ventilator is on the circulate mode, so that it's not, you all know what I'm talking about, right? The button that will make sure the circulation is internal. Every car has it. So that you're not taking air from outside, and you do that about I think in Korea you actually have to do that about half a kilometer or a kilometer before you get to the corona testing center, because that testing center is a high risk place. That's where there are some real patients, and you are probably going there just for a common cold, and you may come back with the COVID case. So right now, I would not do it in US and Canada. Just go and get tested, because it's complicated. But if you are in a place where you can get tested,
Okay. Okay, thanks a lot. That was a really good info.
വേറെ ആർക്കെങ്കിലും എന്തെങ്കിലും ചോദിക്കാനുണ്ടോ? I don't want to keep you a lot, doctor, because this is your precious time. We all thank the doctor community from our side. Karnam, it is a very difficult part. I also have doctors in my family. When I talk to them, they're like, I have not met my daughter. In sister, she's not seeing her daughter from 2 weeks. So that's a very painful situations. So we all thank you for all the services you all do. Where ആർക്കെങ്കിലും ചോദ്യങ്ങളുണ്ടോ? I think I don't think so. So thank you so much again. We appreciate all the effort. ഈ ഒരു ടോക്ക് തന്നതിനും ബാക്കി സർവീസസിനും. And hope everyone be safe. എല്ലാവരും hand wash ഒക്കെ ചെയ്യാൻ. I liked one point about what you said. കാരണം ഈ hand sanitizer വാങ്ങാൻ വേണ്ടി ആൾക്കാർ rush ചെയ്യുന്നുണ്ട്. So better wash your hands. അത് തന്നെ safe ആണെങ്കിൽ അത് ചെയ്യുക. Than buying with lot of money. ആരോ ഒരാൾ ഞാൻ കേട്ടു sanitizer like $100 ഒരു sanitizer മേടിച്ചു എന്നൊക്കെ. So that is not required if you have soap and water. So be safe. എന്തെങ്കിലും പ്രശ്നങ്ങൾ ഉണ്ടെങ്കിൽ talk to people because depression is another thing which is going to hit everyone sitting at home. കാരണം talk to people and communicate. വിളിക്കുക, സംസാരിക്കുക, ഷെയർ ചെയ്യുക, കറക്റ്റ് ഇൻഫർമേഷൻസ് ഷെയർ ചെയ്യുക, തെറ്റായ ഇൻഫർമേഷൻസ് ഷെയർ ചെയ്യാതെയും പാനിക് ആക്കാതെയും ഇരിക്കുക. So that is also one thing which we have to make sure that no one is doing it. And I think that's all. Thank you.
Thank you all and be safe.